Hi, as a first medical imaging technique, I want to discuss now X-ray and X-ray CT. So what is X-ray? There is a history that in 1895, Wilhelm Röntgen published a paper on a new kind of ray that he doesn't know what that exactly means. And so he uses X-ray to image that a spatial map of object susceptibility to penetration by that rays. So, so this is the schematic of the conventional X-ray imaging. So what is X-ray? Which is an ionizing radiation, which means its wavelength is quite short and the energy of this photon is pretty high, so powerful. So the wavelength is only about 10 picometer to 10 nanometer. Remember, 1 angstrom is the size of a hydrogen atom. So this is pretty a short wavelength, meaning that the energy is high. So which the energy is almost about 100 kilo electron volt to about 0.1 kilo electron volt. So this it can hit the target and actually ionize, which means it can eject electron, the valence electron, out of an atom. So, however, this is can be used for medically. So you see, electron beam shoots a target, which will send out X-rays outside. And this is so powerful that through the sample, it penetrates through the sample. You can see it doesn't even bend or diffract. And so if you have a film on somewhere in distance R2, then you can see a magnified images. So between this R1, R2, you can see R1 with respect to R1 plus R2 will be magnified. So the properties of X-ray for imaging is because our human body is translucent to X-ray, which means the X-ray can penetrate with a partial absorption, which can expose photographic film in the past, and now we have digital X-ray camera. So translucent means it's in between transparent and opaque. So that gives us a cool ways of looking first time through inside the body. So conventional X-ray imaging is a formation of medical imaging by X-rays. So let me just explain conventional X-ray imaging. As you see, there is an X-ray source or tube. There's an X-ray coming out. There are filters and collimator making the X-ray direction into a parallel in this particular case. Then this is, let's say, a patient body. Let's say this black ones represent a bone and this color represents some other organ. And that X-ray is penetrating because it's high energy photon that it actually we put as a ray, which means it won't bend, it just go straight. And we have an anti-scatter grid, which blocks the scattered X-ray, so it passes through and it hits a fluorescent screen, and that is a detector. So we can use either film or this fluorescent screen, or we can image it using image created at the detector. So you can see that X-ray passing through this part will be different contrast because it has been observed much, okay? So the image on the film or other detector is a projection of the density map of the 3D object, but we are looking only 2D planar or 2D projection. And the projection is a shadow of a 3D object. It's created on a plane in which each position represents the penetration of X-ray through the body, the full penetration. And this simple two-dimensional projection has been very useful, that the applications include breaks in bones, cavities in teeth, fluid in lungs, and even cancer in the breast. So I brought one example of my teeth from dental X-ray. So, you know, with this, this is the X-ray source rotate through my face, and it takes this X-ray figure. And that particularly the dentist showed me that I have this gap between this right side of my teeth, and this happens to be the place whenever I ate some meal and there are like foods and debris will be kicking inside. So after this, I understand the importance of flossing after meal because I realized this part is always, many times it has a problem. Okay, so conventional X-ray imaging has also limitations, and that's, I want to show that conventional chest X-ray here. You can see a bones very well, but somehow you cannot see many things inside this lungs. So very poor. So that is poor soft tissue contrast. So because the contrast mechanism is the absorption of the X-ray which is bone is the most easily absorbing the X-ray. So that we are based on this attenuation, and we can have attenuation coefficient for each of these tissue. So that original signal of N0 after through this X amount of tissue that will be reduced by exponential decay with N. So that mu is called tissue linear attenuation coefficient, and you can see the unit will be 1/length. So the example of X-ray for digestive system, and sometimes because of this poor soft tissue contrast, we use a external contrast agent to enhance the differences in density within the body. For example, swallowing a dense element such as barium, and then that can show the internal gut. So for example, diverticulitis, which is a litis means inflammation in the diverticulum, and sometimes a polyp, which is cancer, pre-cancer inside colon, can be detected by using this help of contrast enhanced X-ray. So I just bring some, like, nowadays what's cool about this X-ray, for example, chest X-ray with rib suppression. Because of the presence of the rib, we may easily miss some important lesions inside the lungs. So this is just an example of a recent research that you see, this is the original, you can see the rib, and one can do rib suppression, and these lesions may show up better. So fully automated lung segmentation and rib suppression methods to improve the nodule detection in chest X radiographs. So that we can use machine learning nowadays, so that after enough of training, one can either, like, we can recognize this rib, and then we can remove that one by machine learning or artificial intelligence, which will allow our radiologists to detect small little changes easily. So now let's move on to more advanced topic in X-ray, which is called computed tomography. And you can consider it as a Sudoku of X-ray version. So you know what Sudoku is, which is by having the resulting rule, you can fill out the inside, which in imaging case, the inside structure. So the CT algorithm is like a Sudoku, a mathematical method applied to the X-ray imaging technique. For the previous ones were 2D projection. Now we want to have a real 3D reconstruction. Reconstruction means because we only have 2D projection data like this, and we want to see what number or what absorption of X-ray element will be here. So that we call computed reconstruction. So idea is very simple. You just take X-rays as many different angles. Like Sudoku, you see different angles and directions to reconstruct 3D image of the body. instead of projections of shadow of density. So this is how. So X-ray source, like in this case, like fan shape X-ray beams passing through, so that you have a detector which is also arc shape, and then this will contain that projection information and you rotate them. So X-ray generator and detectors move in a circle around the patient and create an image of one cross, in fact, section through the body at a time. So one cross section, for example, we are looking at the brain section, then here's an example. So you see, this is brain section inside, it's not projection, it's a reconstruction. And as you see, there's a high contrast in the bone and a little bit, you can see vaguely poor soft tissue contrast. However, after the CT with a contrast enhancement, and now this is one slice, but you can make multiple slides to reconstruct the whole as a 3D. And that's a good example is here. This is a human a bone in the neck, and here you see the contrast enhanced carotid artery. So this is possible by technology enhancement, by helical, like making these this cross-section as a helical so that it can move faster, or spider CT scanners. So this will allow us to find out if there's any issues and problems inside our brain vessels or vessels in the carotid artery. So next time, I will discuss about ultrasound. And thank you very much for your attention.